Hi, so I am answering a Ask Diana question that was submitted. You can submit your own questions if you go to truetoucounseling.com. You can submit an anonymous question, or you can link it to an email and I can respond to you directly. But if you submit it anonymously, just check back and see when I answer your question. So I wanted to create a space for anyone to ask any question that they wanted without kind of having it come back to them or come back on them at all, just really a safe space to ask anything you wanted. And in that same vein, sometimes I may change the question a little bit, or I may kind of edit it a little bit, just because my goal is your safety and that it is remaining anonymous. So I may also kind of leave out things that you say, or you can say, hey, I don't want you to share this part, or whatever. So it's all up to you. I want you to feel safe. This is your question and your answers. So I'm just gonna summarize this question a little bit and then answer it. So basically, this question is about somebody who had some trauma as an early child. It sounds like some sexual trauma. And to deal with that, they repressed it, which is really common. So a lot of people come to me not being able to remember a lot about their childhood, but they know either something happened or they know things happened, and then from there they just repress and don't remember a lot of things. That's a pretty effective coping strategy, honestly, because if you can't deal with it, especially as a child, you just shut it out and you don't deal with it. The problem, like this person is having now, is the issue is coming up and they're being impacted by it. So the other piece of the question is, if that's the case, either you are repressing some things or you just have some really painful trauma that you don't want to deal with, do you have to relive that to go through it again and to process it? So the fear with a lot of people is, well, this was already so painful and I can't deal with it and I couldn't deal with it then, and I don't want to go to therapy because I'm just going to have to sit there and sit in my pain for the whole time and just keep reliving it and keep talking about it. And sometimes that's too scary for people to deal with. So that's another piece of this question is, to get help, do I have to relive my trauma and my issues? Okay, so basically my thoughts on this are, therapy is supposed to help you, and it's what you're ready for and it's what you want. So if someone is pushing you to go somewhere that you're not ready to go, that's not effective. So if you go to therapy, you need to be able to say, this is what I'm comfortable with, this is where I'm at, this is what I need. So if someone came to me in this situation and said, you know, I don't want to relive all of this, I know there's a lot there and I can't go there, I don't want to go there, then I wouldn't go there. We're not going to push them to go there. Okay, so this person, it sounds like, could benefit from therapy and could benefit from therapy in a few different ways. One of the ways that comes to mind is, I think there's a lot of issues coming up around social situations. So a lot of anxiety coming up in general and a lot of social anxiety coming up. So this person is having more issues in social situations. So that's coming up in a very different way than happened in the past. So basically what they're saying is they know it's from early trauma, but it's coming up in a different way. So now it's coming up as an adult, it's coming up in social situations that they're in as an adult. So if that's the case, and that's one of the most bothersome symptoms, we can go there and address some of that social anxiety. We can address kind of what's coming up, what the issues are, what's sort of the anxiety that's coming up, and give you coping strategies to deal with that. So we don't have to go through and relive and reprocess all that stuff in the past if you don't want to. What we can do now is say, okay, what's happening now? What is playing out for you now? What does your social anxiety look like now? How is that happening? What are the triggers that are happening? And then we can help build ways to cope with that in the now, in the moment, in the present. So that could give you a lot of relief in the way that it's playing out for you now. And there are a lot of different ways that you can do that, a lot of different ways that you can work to reset yourself, there's a couple different routes that I would think of to go first that you could kind of play with as far as coping strategies and ways to deal with anxiety and social anxiety. So, no, you don't have to do anything you don't want to do. You don't have to relive trauma if you don't want to do that, or, if you just don't want to go there right now. You can deal with what's happening now, and you can get some relief that way in the now. So I think that's one way to do it. You just need to be really clear about where you're willing to go and where you're not. I think that this is something that comes up for people when they go to therapy. Typically they go in saying, hey, this is where I'm at, this is what I need, or they wait to go in until they're ready to deal with it in full. But often that doesn't happen, right? Maybe you're never going to be ready to deal with it in full. Maybe that's too scary. You can take it piece by piece. So I would say just make sure you advocate for yourself in what you need and what you want and what you're ready for. But it sounds like you're suffering right now, and I think you could use some support. And you deserve some support, and you deserve some relief, and that doesn't have to be more painful. That can be really symptom focused and really coping focused, and that's okay. I think the fear that you are kind of feeling, as far as the fear of going into therapy to have to face more pain, that is possible. That is a true fear, which is why you need to kind of advocate for yourself, and then also make sure you know what you're getting into and what you're ready for. Because sometimes it does hurt, and it does get harder before it gets better. That's real, and that's true. I remember, I went to therapy when I was, I guess, early college, and my therapist then, I remember her describing it as sort of a wound that we've put bandages over, and it started to heal, but there's an infection under there, and if we don't go in and clean it out, then it will never heal properly. But cleaning it out hurts, right? Which is kind of what you're scared of. And for you, it sounds like cleaning it out right now it's too much. Going in there and cleaning it all out, that's too much for you to deal with right now, right? But often that is kind of what we need to do. So in my case, her thing was like, okay, I know it hurts to go there and clean it out, but if we go there and we clean it out, then you can start to heal for real, and you can really start to move forward and move past it. And eventually, it's a scar, and then over time that scar will fade, and maybe it will always be there to some degree, but it's no longer impacting your daily life. And if we're thinking of it just in that metaphor, it's no longer impacting your movement, right? Maybe you forget about it, and maybe you look at it and you're like, oh yeah, that did happen, and that did create who I am now, but it's no longer impacting me. But for really deep trauma, we don't have to do that. Maybe it's changing the bandage. Maybe it's disinfecting spray. Maybe it's learning to work around the injury. Maybe it's learning different ways to kind of interact with life so you don't have to go there. You don't have to use that, part of your body, if we're staying in that metaphor, right? So it doesn't have to be the case, but yes, it often is. So I think the fear that you're describing is true, and is true for a lot of people, that it does get worse before it gets better. The hope and the point of that, though, is that it does get better. Okay, so yeah, and speaking from my experience too, there's no way I would have gone there if I didn't believe that it would get better. And there's no way that I would walk with my patients through their pain, or with my clients through their pain, if I didn't believe that it would get better. But you have to build enough coping around that to be able to handle it, and to be able to make sure that's a good idea. So you don't want to walk through your pain too early. So for some people too, I've even, like I'm suggesting with you, is I've worked through coping before even going there. So I'm not saying you have to go through your pain, but for someone like you who has that level of pain and trauma, if you were going to ever go there, I would still say build the coping skills first, So when you do start to walk through your pain, you have ways to cope with it. Because if we just tear off that bandage and we have no way to deal with that pain, I mean, that's just pain for no reason. But if we are creating coping skills first and helping you deal with emotion and deal with all of these things that are going to come up, then when you do, or if you do decide to walk through your pain, you'll have more skills for how to manage that and deal with that in a healthier way when you do that. So the fear is not only for yourself often, that's going to kind of, be purely painful for you and unearth sort of your stuff, but also if you have a family or if you have a partner, that's going to be really hard for them to go through as well. If you are really struggling, or if you have a job, I mean, obviously we're not going to push you to anything that's going to completely shatter your world if you can't cope with it. So if you do decide to go to those painful spots, I would say make sure you have enough coping skills and you feel better and you feel solid enough to be able to handle that. So don't go there if you're not ready for it, if you don't have those skills yet. So I think no matter what you decide to do, whether you decide to dive into some of that trauma or not, developing coping skills will help. It will help with your day-to-day life. It will help with your symptoms now. It will help with your social anxiety now. So get some coping down and figure out some ways to help you feel better in the present and in the now. The other thought that comes to mind is there are also some other strategies that are really, really popular for trauma, like EMDR, eye movement desensitization, and rehabilitation. No wonder it's the acronym, right? EMDR, that's a mouthful. And maybe I'll shoot a video just about EMDR. Comment if you would like that, if you want me to shoot a video just on EMDR. EMDR is really interesting. It's another strategy that some people go to deal with trauma, and it probably is another video to describe that. But it's really short term, and it's meant to give you relief from some of those memories and for some of that trauma. It's common for managing PTSD. It's common for veterans to do. I worked with people who have done it or choose to do it, and then maybe they'll come back to me for working through some of the other things that are still there. But it's a very pinpoint type of therapy that is short term and meant to offer relief, and it's not talking through and reprocessing through. It's more. And I'll just shoot another one on how to describe this, because it sounds a little bit weird if you haven't heard of it before. But it's more like thinking through some of the stuff. So you would need to go there and think through some of the things that happen. But then they'll just help you sort of process that and kind of move it in your brain, so it's not in the forefront. You're not reliving it. It's now like a memory that you can sort of deal with a little bit easier. So that's also another option. You could go like an EMDR route, just to kind of deal with the trauma and hopefully process it a little bit more, and then maybe you're ready to do more typical psychotherapy and talk through it, or maybe you just feel enough relief that you feel better for a while. So something like that could also be an option. Yoga is also really huge. It helps with trauma a lot. So just like EMDR, trauma-informed yoga is also really research-backed in being able to relieve some of these symptoms. So maybe you check out a trauma-informed yoga class, or even a regular yoga class can help, because that's not directly dealing with the trauma and making you process it, but we have learned through researching this that working through things in the mind, in the brain, in the body, and kind of working through it that way can help relieve trauma symptoms. It can also kind of give you a control back control back over your body, help you feel in control of yourself, and connect you with yourself and your body. If that sounds really scary for you, I would say maybe start with a trauma-informed class first, because they're going to be really conscious of that. It's going to be slow. It's going to be you know, it's all going to be choice-based. So you choose what you want to move and how you want to move it, and if you do or not, which you can also take into a regular yoga class. You don't have to do anything that you don't want to do. So if they instruct you into something, you choose whether you do that or not. So those are some routes that could also be helpful. Anything physical could also be helpful, so maybe getting active could be helpful. All of these things are sort of ways to relieve some of the symptoms without dealing with directly, you know, with the trauma, with the root. So, yeah, those are some of my thoughts. I would say get some help, get some support, start building some ways to cope, find things that help you relieve stress, help you relieve anxiety, and go to those places that hurt when you're ready, if you're ready, and with some help and support. You don't have to walk that path alone. You don't have to walk it unless you have, you know, some skills to help you along the way. If you have any questions, please ask more. I would really be interested in hearing how this goes for you, maybe what barriers come up as you kind of keep going in this, and sort of what you find helpful. I'd be interested in hearing all of that. And again, if any of you have other questions as you're watching this that you would like me to answer, please ask. Feel free to comment below in this video, or shoot me a message, or submit a question on the Ask Diana page on my website, and subscribe. Subscribe to the YouTube channel, and I will keep answering your questions and addressing things that you guys find helpful. So I hope you have a great day, and I hope some of that helps.